Welcome back. We're talking tanning this morning.
That's right, and everything associated with it, from sunscreen to skin scans. The CDC and the National Cancer Institute found half of adults between 18 and 20 reported at least one sunburn in the past year. Of course, that increases their risk for skin cancer later in life. Researchers also found indoor tanning is still pretty common among young adults, with the highest rates being among white women between 18 and 21. Dermatologists say younger adults need to realize a tan may not be worth it in the long run.
Now, skin cancer is the most common form of cancer in the United States, and melanoma is the most deadly type of skin cancer. Exposure to ultraviolet radiation from the sun and from indoor tanning equipment is the most important preventable risk factor for skin cancer. Indoor tanning before age 35 increases a person's risk of getting melanoma by 75%.
A more detailed report backs some of that information up about who's using tanning beds. The study specifically found white women between 18 and 21 had the highest rate of indoor tanning. 32% of that group says they used a tanning booth at least once in the last year, but on average they went 28 times. Overall, just over 5% of adults reported indoor tanning in the past year. Of them, 58% of women and 40% of men say they went at least 10 times.
Now, of course, we can't talk about tanning without mentioning the New Jersey mom that's accused of taking her 6-year-old to a tanning salon. Patricia Krenzel has now been banned from Planet Sun, which was the indoor tanning salon that she used to get all that color. The company put her picture up at all their locations so that employees will turn her away.
Meantime, H&M is apologizing for using an extremely tan model in its latest swimsuit ad, but won't agree to pull this ad. Now, the company has been taking criticism from dermatologists and cancer foundations, claiming the tanned and toned model would encourage young women and girls to tan more. One op-ed piece in Sweden's largest newspaper says H&M is promoting a deadly beauty. The company did apologize and says it will take the remarks into consideration for future ads. But again, they're saying right now they're not pulling that ad.
Right. Well, by the way, here in Connecticut, anyone under 16 must have written permission from a parent or guardian to use a tanning facility.
The FDA, meanwhile, is giving manufacturers more time to adhere to new sunscreen recommendations. The changes will require new labels to give consumers clearer, more accurate information about what the sunscreen specifically can and can't do. Things like claims it's waterproof or sweat-proof. The initial deadline was June 18th, but the sunscreen task force requested more time, so they'll get another 6 months. Some smaller manufacturers will get even more time, about a year and a half. So when you head outside, dermatologists say be sure to lather up frequently until those labels can explain exactly how long it will last.
Now, some of us from time to time might hit up WebMD or some other sites to try and, self-diagnose ourselves.
And a new app called Skin Scans was designed to help diagnose skin cancer in its early stages. Michelle Stark puts this health tool to the test.
And the machine calls it medium risk and says to keep an eye on it.
You think it's probably
Huntsville dermatologist John Sowell has seen a lot of suspicious skin lesions over the years, but never an app designed to analyze them. Skin Scan offers digital diagnosis of moles on the body using the same markers doctors look for: asymmetry, border, color, and diameter.
It seems like this app is set up to be pretty sensitive, so it picks up slight irregularities in brown lesions, even benign brown lesions.
Sowell reached that conclusion after a couple of tests on his own and after putting this technology to the test on us.
nerve-wracking.
So that looks like a benign lesion to me.
For each spot, we took a picture, uploaded it, then waited for analysis. My moles all checked out with low or medium risk, but my photographer, Tim Hansen...
So see, they call that a high-risk lesion because of that little white spot that you had.
Despite that high-risk result, Dr. Sowell didn't think Tim's mole was anything to worry about until Tim mentioned it had bled.
One night I woke up and I must have clotted or something.
That's how he wound up here.
Yeah, Tim? Yep.
Just to be safe.
Moles that bleed, it's probably best to do a little biopsy, be sure they're okay microscopically.
The moment highlighted one of the major shortcomings of Skin Scan.
It doesn't account for recent change in a mole, if there's recent growth, or if a mole has begun to itch or have some symptoms.
The app's sensitive nature could also lead to false scares. Still, Dr. Sowell sees SkinScan as a great tool for awareness. The American Cancer Society says melanoma, the most serious skin cancer, will account for more than 75,000 cases in 2012.
We see a lot more melanomas now than we did 20 years ago.
Thankfully, Tim's mole was not one of those cases. And despite SkinScan's helpful readings, Sowell thinks patients will, at the end of the day, want the assurance that comes from talking to a doctor in person.
Painless.
No matter how high-tech our tools become.
I would say that if something looks odd enough that you want to photograph it and scan it into your app, I would always call a physician as well.
Now, the obvious concern with apps like that, maybe someone with a questionable mole or mark could actually have cancer but never see an actual doctor.
Now, joining us this morning to talk about the app and all things tanning is Dr. Stanislaw from St. Francis Hospital. Good morning.
Good morning.
Now, first, we have to ask you what you think of that app.
I tried it over the weekend, and I studied one mole, or I did a couple moles, but just an example, I studied one mole that I knew was benign. 40% of the time it came back as high risk, 40% of the time it came back as low risk, and 20% of the time it came back as intermediate risk. So everything's standardized, same mole. It's like a coin toss. So I would not rely on it at all.
So you would advise against using that?
I do not feel comfortable with that trying to make a diagnosis.
You think that if people are just concerned, they should just go see a doctor rather than
start with your primary care doctor, have them look at it. If they're not sure, if they're worried about it, then they should be referred to a dermatologist. There's no substitute for a dermatologist.
You think it's just causing unwanted, scaring people?
Well, I think
unnecessary?
Well, absolutely. I mean, 40% of a benign mole comes back as high risk. Just think about all the stress. And most people, the problem with lesions is that people see it, they know it, but they're afraid of the results, and it just delays their care. When in reality, the earlier you get this checked out, the better off you're going to be.
And Dr. Stanislaw, we just talked extensively about tanning. Talk to us a little bit about the difference between tanning at a booth and then the sun outdoors. Both are dangerous.
Correct. Basically, what they mentioned in that piece before was that if you have an indoor tanning session less than the age of 35, your risk for melanoma later in life is 75%. One or more blistering sunburns in childhood increases your risk to 50%. So this is just more intense. It's right there, and the World Health Organization in 2009 put it in the category as the highest carcinogenic risk factor, along with plutonium and cigarettes.
I mean, is one more dangerous than the other, whether being outside or being in an artificial booth?
It's tough. It's a relative question. If you go out all the time and you're never putting your sunblock on and you're getting all sunburns over your entire lifetime or your entire childhood, that's pretty severe. But if you took the same amount of time out tanning in a tanning booth, the tanning booth is going to be more severe.
So if you are heading outside, what's a good guideline as far as an SPF, what you should use?
SPF is very misleading because the way they measure that is they shine a very narrow wavelength of ultraviolet light on the skin, and they record how long it takes for you to get a sunburn. So if it takes 10 times longer, it's SPF 10. If it's 30 times, it's SPF 30. It doesn't tell you the spectrum of what it covers. So, that is a very narrow wavelength, and sunlight is UVA, UVB, and UVC. So it might block you from getting a sunburn, which is your evolutionary warning sign to tell you get out of the sun. So if you get a sunburn, you've had too much. So now you play, 9 holes of golf, you don't get a sunburn. Well, now you're going to go out and play the back 9 because you think you're safe. In reality, you're getting all the ultraviolet light that causes skin cancer and all the age-related changes as well.
I know I'm guilty of it. You go outside, sometimes you don't even think about it, and all of a sudden you're like, oops, I have a sunburn.
A little pink, yeah.
But now having a baby, I'm constantly slathering her up. Are the guidelines any different for kids than they are for adults?
No. Basically, the best ingredient that you should look for is zinc. The highest percentage of zinc that you can find is the best. So about 9% or higher is definitely the safest, because zinc gives you the broadest spectrum. Titanium dioxide is second best. It's very close. But they're both, the higher you get, the little bit thicker, the whiter it is. But at least you have to apply it essentially every hour and a half. If you're getting sweaty, if you're in the water, the thicker, the better. Like I see people using the spray bottles all the time. I just don't know how well that is, how good that is, the protection, especially if you're in the water, if you're sweating a lot.
Or if the wind blows and it goes over there and
exactly.
you're standing there.
Touch your neighbor.
Yeah. All right, now we have to ask, what do you think about this obsession with being tan, from the ad that we saw just a few minutes ago to the, I guess we can say, tanorexic mom that we've been hearing a lot about in New Jersey?
There's definitely a population, and I don't know if there's a true psychological diagnosis for it, but you can't, it's in their body image, they feel that they look great being dark, dark, dark. And no matter how you try to rationalize with these people about the skin cancer risk, the effects of aging and stuff like that, they still tell you, I feel much better if I'm tan. I look much better if I tan. And they could look like leather. I mean, they could be shriveled up like a prune.
Well, case in point, that mom there in New Jersey, I think a lot of people would say if she eased off the tanning for a few weeks or a month, she would probably look 20 times better. I mean, a world of difference if she was just easing up a little bit on that tanning.
But that really comes to like a body dysmorphic, you know, category.
So it's more psychological.
Yeah.
If people are really desperate for that, you know, sun-kissed look, is more like the spray tan or
well, there's no such
like
thing. There's no such thing as a good tan. So basically, any of the spray tans, whether it's a spray tan, a cream, a foam, those are very safe. It's just a complex sugar that's been around since the 70s. What they've done is they've changed the bronzers in it, so it looks much more natural. That's the safest way to go. The only thing that you have to realize is it does not impart any sun protection. You know, some people think, oh, I'm tan now, I can go out in the sun more. It does not do that at all.
All right, now one more quick question. For those of us who admit, I've tanned before my prom in high school. I know a lot of people have, but now we're very proactive about wearing our sunblock. What should we be doing knowing that we have tan a little bit more than we have in the past?
I think that you have to take it as a conglomerate. If you have a family history of skin cancer, if you have a history of skin cancer, you should have your skin checked once a year by your family practitioner or your primary care doctor. Very, very important. I think that people assume that all the damage is done so I don't have to worry about it now. Absolutely not the case. It's all cumulative. So the better you are now, the better off you will be later in life.
So be proactive.
Correct.
Great advice. Thank you so much.
For being with us.
Thank you for having me.